Glioblastoma multiforme, or GBM, is a rare brain tumor. It can be difficult to treat and has a poor prognosis.
Today, one woman's journey from her shocking diagnosis to her determination to survive.
Let's go behind the mystery of glioblastoma multiforme.
I would describe my life in my early 30s as work hard, play hard, nap hard. I practiced law in New Hampshire for a few years, and then I decided to move to Washington, D.C., where my life became pretty hectic. So a few years after moving to D.C., I started to notice that I was getting increasingly severe headaches. When I'd stand up, I'd feel like I needed to faint. I had pressure behind my right eye, and I continued to work like I always had.
Jeanneane went to 4 doctors to figure out what was wrong with her, but had no success. Unable to do her job to its fullest, she resigned and moved to Texas to be with her family.
The final thing I had to do before my move was a final doctor's appointment. When I pulled up to the valet parking stand for that appointment, I suffered a seizure, and that's what led to me getting diagnosed.
The Balancing Act met with Dr. Suriya Jeyapalan, a neuro-oncologist, to learn more.
The glioblastoma multiforme is a type of tumor that occurs in the brain. Clinically, they are divided into 4 grades. GBM is grade 4, and it is the most aggressive. They infiltrate then throughout the brain, and they grow. Treating GBMs is a challenging task, not only because of the location of the tumor, but because of its complexity.
Common symptoms of GBM depend on the location of the tumor and may include headaches, impaired coordination, dizziness, blurred vision, and frequent fainting.
If you have neurological symptoms and your physician suspects you of having a tumor, the neurological exam includes looking at everything. They'll do imaging, which usually initially is a CAT scan of the head. If they see a mass, they will do further imaging of a brain MRI in order to confirm the diagnosis.
After they ran a CAT scan, they let my dad and I know that they suspected that I had a brain tumor. And at that point, I felt the need to call my mother and let her know. And I didn't want to hear her reaction because I was feeling guilty about, having to put my family through this already.
Immediately, my world fell apart. I couldn't hardly process it in my mind, what she was saying to me. And I was devastated, and I was in shock. It was the most terrifying phone call I ever received in my life.
I was admitted into the hospital, and I underwent an 8-hour surgery to remove the tumor. At the follow-up appointment with my oncologist, I had my whole family with me. We got the diagnosis of a grade 4 glioblastoma, but I could tell with my whole family and what they were saying to me that every single one of them was dedicated to helping me as much as possible.
So the current standard of treatment for newly diagnosed GBM patients, so the surgeon will analyze the MRI and make a decision whether they could do a biopsy or they can do maximal safe resection. Then the patient receives 6 weeks of radiation combined with an oral chemotherapy called temozolomide, and then a month later we start giving them maintenance chemotherapy with temozolomide. Even though at times, the surgeon, with his maximal safe resection, can remove everything that we can see on the MRI. The disease comes back. We can't get rid of every single little cell.
Novocure, a global oncology company, is working to extend survival in some of the most aggressive forms of cancer by developing and commercializing its innovative therapy, Tumor Treating Fields. Tumor Treating Fields interfere with glioblastoma tumor cell division. This interference slows or stops glioblastoma cells from dividing and may also destroy some of them. Optune is a wearable, portable, FDA-approved device indicated to treat glioblastoma multiforme in adult patients 22 years of age or older. If you have newly diagnosed GBM, Optune is used together with chemotherapy called temozolomide after surgery to remove as much of the tumor as possible. If you have GBM that has come back, Optune is used after receiving chemotherapy or alone as an alternative to standard medical therapy if surgery and radiation did not work or are no longer working. Optune is not for everyone. Talk to your doctor if you have an implanted medical device such as a programmable shunt, skull defect, missing bone with no replacement, or bullet fragment in your head. Talk to your doctor if you have a sensitivity to conductive hydrogels, like the gel on electrocardiogram stickers. Do not use Optune if you are pregnant or planning to become pregnant. The most common Optune-related side effect was a skin irritation beneath the device transducer arrays. Most patients reported mild to moderate skin irritation. This is not a full list of risks and side effects. Talk to your healthcare provider and read the Optune instructions for use for more information. Please stay tuned for the full important safety information at the end of this segment.
We were delighted to find out that there was another treatment for glioblastoma. The first doctor that told us about Optune was Jeanneane's neurosurgeon. She was so positive and we trusted her. She was highly skilled.
During my maintenance chemotherapy, I was able to add Optune. It was a relief to know that there were additional treatments available, and I was all in for Optune when I learned more about how it worked.
In a large clinical study of people with newly diagnosed GBM, nearly half of people using Optune plus chemotherapy were alive at 2 years, compared with 31% of people on chemotherapy alone.
The recommended usage rate is 18 hours a day, which is about 75% of the time. And I drive with Optune, also to go to the grocery store, to go to the movies with my nieces and nephews. One thing about Optune is that it cannot get wet. And if my family is planning any activities or vacations around water, I just remove the Optune and take a small break from it. And as long as I'm hitting that 75% usage rate, I'm okay. And it took my family a little time to kind of adjust to helping me, but everybody kind of after a few weeks got the hang of it.
Well, when I found out I would be the one that would be shaving her head and applying these arrays, I was a bundle of nerves. But we all learned very quickly, and in a couple of weeks, it became very easy to me. If you're a caregiver taking care of a loved one with cancer, I do encourage you to take time for yourself, to get the support that you need, because by caring for yourself, you'll be able to care for your loved one in a more effective way.
Patients should definitely feel empowered to educate themselves about their disease. So I really encourage people when they're discussing Tumor Treating Fields or learning about Tumor Treating Fields to really speak to their personal providers about this treatment option and see if this is the right thing for them to do.
I've been told that there's no cure for glioblastoma. I have really appreciated Optune. I do encourage GBM patients to listen to their bodies and have open and honest communication with their oncologists about anything they're experiencing.
I've learned that life can change on a dime, that one day it can be sunny and the next day you're facing the greatest storm of your life. I've learned how really strong Jeanneane is. To see her have the courage and the bravery, and even in the greatest suffering, I've just learned her true character, which I am amazed and honored to be her mother.
What an empowering story. Oh, Montel, goodness. You can learn more about Optune at optune.com or go to our website, thebalancingact.com.
Important safety information and full prescribing information are available at optune.com.
Stay tuned for full important safety information.